This is going on YouTube. You're exactly right. And I will tell you that when it comes test time for this particular test, because some of this stuff is so new to you, it'll probably be a good idea for you to go back and listen, especially to this part, because you aren't really going to know this information. Caroline, when you turn the light off, you can close the door as well. All right, so you need to head this up on your paper as government agencies, and we are talking specifically about government agencies that provide some kind of health information. Yes?
Where do you record it at?
Right here.
Oh, you're recording it on?
It's magic.
Well, I didn't know what you used to record it.
I know, because you're looking around, looking for a recorder. No, it records not only my voice, but it records the PowerPoint as well.
What you're saying now is
Every single thing that I'm saying right now and everything you see up there, it's just like being in class. That's why I do it, because for people who are absent, they don't have any excuse to say, what did we do? Go back and look on YouTube. You can see it.
You post a link up on Edmodo?
It is on Edmodo. Mm-hmm. It'll always be on Edmodo. And if you just click on that link, it will take you directly. Now, what you need to understand about that, the YouTube, though, is my first aid videos are on there as well. So it'll say meds, and they're not separated. So you just have to look at it and see that it says med skills and then the date. So you'll have to know the date that you're trying to look. Of course, if you know that this is what you're looking for, you can see it'll look just like that, because that's what I started with. All right, so let's look at some of the government agencies that we need to know about. First of all, when we're talking about government, you know that we've got a federal government, which governs the whole United States of America. We've got a state government, which is the state of Florida. And we've got local government, which is like Tampa has its little government agencies, and Pasco County has its little government agencies. But we are specifically talking about health type agencies. So you have to understand that depending on where you go and what you're going for, depends on whether or not it is a federal or state or local government. And different organizations within there offer different services. And you'll see that in just a second when we're talking about that. All of these government agencies are funded by your taxes. You know how you hear people complaining all the time about taxes, paying taxes, we shouldn't have to pay taxes, okay? And you look at you go to buy something for $50 and, I don't know, $8 worth of taxes is added onto that, and you hate that, and we all do. But the bottom line is, we've got to fund our government somehow, and it is the government for everybody. It's not doesn't just pick out, certain people. So it is a benefit to all of us. So yes, we have to pay taxes, and that's what funds these agencies. Somebody's got to pay for it. What are they responsible for? They are responsible, and we're talking about these particular health care agencies that we're about to talk about. They are responsible for direct health care. Like in Pasco County, we have the health department that you can go to. And most of the time, the services there are free. If they're not free, they're really, really inexpensive, as opposed to going to a doctor's office or hospital. So your taxes fund that, so that whatever part of that is free or lesser expensive is a benefit to you. That's your direct health care. They are responsible for our food and water safety. They are the ones, have you ever heard on the television where they'll say, and I've seen this a lot at Ben Davis Beach, they'll say Ben Davis Beach or Safety Harbor area is closed to swimming because of a high bacteria count, and so you can't go swimming in those areas. They are the ones that go and test the water to make sure that the water does not have bacteria that is harmful to you, like the brain-eating amoeba that has been found in so many places lately.
Is that when in Hillsborough they say don't drink from
Yes.
your tap water?
Yes. Or sometimes if there's a water main break, they'll tell you to boil your water before you use it. They'll tell you not to go swimming in ponds or the lakes behind your house, because water that is stagnant, it just stays still, bacteria grows in it, and then you get it in your nose or you get it in your mouth. Even if it's accidental, then those things are going to make you sick. Our food, they're also the ones that go in restaurants. Do you ever watch that on the news where they go in the restaurant and they grate it? And they say, because I know that last week they shut down on Del Mabry, one of the Velarda restaurants, shut it down. They went in they go in randomly without any warning, and they do a health inspection. They go in the kitchen where the food's being prepared, and the temperature has to be exact in the refrigerator. The temperature has to be exact where they're cooking stuff. Everything has to be cleaned. And they go in there and they find roaches or evidence of roaches. They're going to shut that place down. This is what's happening. So to say that that doesn't matter to you, how many of you eat in restaurants? You never even think about whether they're clean or not, because we have a government agency that goes in there randomly and checks to make sure it's clean, so that when we go in there and eat, we don't have to worry about getting any kind of food poison. So yes, that's what your tax dollars do when you pay those taxes. And I'm okay with that. I'm okay with that. Okay? The other thing they do is education. Your government agencies, whether they're federal, state, or local, they do education. For example, if you were going to the health department in Pasco County, there's an office in Dade City, there's one in Land O'Lakes, and then there's one over in Newport Richey. You can go to those things. Let's say that you are afraid that you're pregnant, and you don't want to tell your parents, and you don't want to go to your regular family doctor because they're going to probably tell your parents. So you go to the clinic. They'll give you that free, like they'll give you a free pregnancy test, and then they're going to talk to you about birth control and those kinds of things. They're going to do education. They do education classes for childbirthing, for bloodborne illnesses. They do all kinds of educational classes. So that's what these government agencies are responsible for, and it does apply to you. Even though you don't directly see it, it absolutely does apply to you. Okay? So here's an example. We have state university medical centers. Now look at what it says. State. So that tells you it's funded by the state government. It is a university medical center. Look at the picture right there. What does that say? Shands Hospital. How many of you know about Shands? Anybody? Shands is a hospital that is directly connected to the University of Florida in Gainesville. It is a teaching hospital. In other words, if you are going to be a doctor or a nurse or probably any other medical field, and you're going to the University of Florida in Gainesville, then when you do your clinicals and you do your work and you do your residency and you learn under other physicians, you would go to the hospital right there. When you're in classes, you'll follow around or shadow a physician. You'll go there to watch surgeries from their viewing room. You'll do all kinds of things in that hospital, because what they're doing is they're using the hospital to teach the students who are going to be doctors. It is also a research hospital where they'll try new drugs on people. Of course, you sign a waiver saying you understand that this is an experimental drug and whatever. But Shands is a big hospital, and a good part of that is a children's center as well. So part of it could be considered a specialty hospital. And so they are training healthcare workers, they are giving medical care, and they are doing research at that hospital. While it's connected to the University of Florida, it is a state-run facility. Anybody can go there. Anybody can go to that particular hospital. Okay? So, again, especially people who live in the area. Sometimes when doctors, I remember when I was teaching, this has been years ago, I had a student who got some strange, rare disease, and she was in the hospital literally for months. And this was when I lived in the panhandle of Florida up in Panama City. And she was in the hospital for months. And they knew that it had something to do with her spine and her brain, because she would have these horrific headaches and they could not ease the pain. And it was bizarre, because the pain would start in her lower back and she literally could feel the pain going up her spine and into her head. They did everything. And they could not figure out what it was. And they finally flew her to Shands, because they have more equipment, they have more knowledge, they do more research. They flew her to Shands for diagnostic, trying to find out what was wrong with her. The only thing they ever found out was the possibility that she had encephalitis, which you can get from a mosquito bite, and it attacks the lining of the spinal cord in the brain, but they never could actually pinpoint it. Normally you can do a blood test or a spinal tap and find that out, but they could not pinpoint it. But that girl suffered. She suffered for a long time in the hospital.
Well, what happened to her if they never actually
You know what? I don't know if it ran its course or if they found something to cure it, but she eventually did get better. She did. But man, we're talking months. Months. So, but I'm just saying, a lot of people go to Shands for help when they can't get it at other places. Okay? So that's one kind of a facility. And then we've got Veterans Hospital. This is right here. This is our Veterans Hospital. It's down by the university, pretty much right across from UCF. What used to be UCF, it's a Florida hospital now, just like all the other ones. It's called James A. Haley Veterans Hospital. Now, what is a veteran? What is a veteran, John? Someone who has been in a war, who has served in the military, okay? So this is a hospital specifically for them. Now, with any injury or any illness, they can go. So it's not a specialty hospital other than it is specified for veterans. And if I'm not mistaken, there's a smaller one over in St. Pete or Clearwater somewhere as well. We call it a VA, Veterans Administration. It is a federal, because if you're in the military, you don't work for the state government, you work for the federal government. So these are people who served in our federal military, and it provides those care for those kinds of people. We also have a veterans nursing home. And by the way, for those of you who are going in the CNA program, when you get up to Miss Jones and you do your capstone course and you do your clinicals, you'll be going out to the veterans. So those are people who need a nursing home. They live there, but they have served in the military, and those are the only people that can go to that particular nursing home because they are veterans. So we have a hospital and a nursing home for those people. Okay? Again, that's a government one. And then we have state psychiatric hospitals. This is a picture of the Northeast Florida State Hospital, which is up in North Florida as well. And that serves the mentally ill. It is not just for veterans, it's for anybody. Now, these are not people who just need to go to counseling. They may have some outpatient counseling, but most of this is a hospital. It's inpatient. You go and you stay there. You get intensive counseling. People who have disorders like schizophrenia, and they may be a danger to themselves or to others. People who are severely bipolar, and they need medications often and regularly to keep from, a lot of people with mental disorders are a threat to themselves and others. So mental hospitals are inpatient. You go there and stay. It's not to say that you won't ever get out, but it is generally long term. And we have other mental hospitals or mental facilities, but they aren't necessarily run by the state. This one is run by the state. Okay? We also have the Public Health Department, which is kind of what I was talking about. This is the U.S. Public Health Department, which is not a hospital like those that we just looked at. That's kind of what that was all the hospitals. So the Public Health Department has 6 responsibilities to all of us. Now, I will say this. Just because they're there does not mean you will ever use them. But they are there if you need them. So the 6 responsibilities of the U.S. Health Department is, first of all, research. What do we need to research? What? If it's an illness, a new illness, and we don't know anything about it, yes, we need, and how fast it spread, what can we do to stop it? Is there a vaccine? Is there an antibiotic? What's causing it? Yes. What else do we need to research? What else, Ramon?
Cure.
A cure for it? Or at least something to slow it down. Absolutely. That's the first thing their responsibility is. The second is to treat alcohol and drug abuse. Prevent alcohol abuse and drug abuse. Treat alcohol or drug abuse. That is another responsibility of the United States Health Department. I got to tell you, there was a time where that was not even an issue for us. Like when I was growing up, there was no such thing in the health department system for treating drug and alcohol abuse. because people didn't really do so much of that, you know. But now it is a huge issue. And so we have places that people can go to get treatment for being alcoholic and drug addicts. That's one of their responsibilities. Another one is to prevent and control diseases transmitted by any of these things: insects, animals, air, water, or people. So in other words, first of all, we want to make sure that the health department tries to prevent it. And the best way to prevent most of this is what? Vaccines, if they're available. If not, it goes back to research. Let's see if we can find one. And to control it, let's say we have an outbreak of it in a particular town. What's something that we could do to prevent it from spreading in a particular town? What do you think, Ramon?
Keep no one going in and out.
Okay, kind of quarantine the area, let people don't go in and out. Anything else we could do to prevent it? To control it? Sanitize. My first and second period, who had to do the hand washing projects that you see right here, some of them also had to do brochures, they had to find statistics to justify why it was so important to wash hands. Guys, if you knew those statistics, one of the statistics that we found was that if everybody would wash their hands and do it appropriately, we could prevent 1 million deaths a year just by washing our hands correctly. It was staggering, some of the statistics about why it's so important to wash our hands. And so, yes, that would be a way to do it. Another way would be to wear masks, the little mask, gloves when we're dealing with blood or vomit or feces, those kinds of things, cleaning, sanitizing, all those things. Transmitted by insects, how are we going to control that? What does the county do? They spray it, right. They come around and spray out of the truck. They do that. They also try to drain ponds and ditches and things of the water because that's where mosquitoes breed, or in water. So they try to keep those things drained to keep the mosquito population down. Animals. What do they do for animals?
Try to keep them, try to give them their own area.
They probably pump it out of them.
No.
What?
No, they don't pump it out of them. Jose, what do you think? We do get vaccines. We give our animals vaccines. If they're wild animals, we can't do that. So what do, Ryan?
You put them out.
We either take them out. I'm talking about wild. Okay, give me some example of animals that carry diseases that could affect us.
Rats.
Bats. Squirrels, some. Rats. Raccoons. Beside mosquitoes, yes. So some of the rodent kinds of things, they carry rabies, among other things. The other thing they carry is fleas. That fleas carry, it's not they that may bite you, but the flea gets on you and it bites you, then you can get those diseases. So, they try to control that population as well, or they relocate the animals. They trap them and relocate them. Ramon?
Deers or moose or any of those have diseases?
They generally do not, unless they have fleas that may have them. But as a general, those things don't bite you because you're not going to get close enough to them. We're only talking about things that may bite you. Yes?
But don't they carry Lyme disease?
The fleas and the ticks. Ticks carry Lyme disease. The deer, I know they're called, you hear that a lot, but it's not the deer or the whatever. It's the ticks that are on the deer that they come off of the deer or whatever they're on, raccoon, whatever, and they get in the grass or whatever, and you walk through the woods and the tick gets on you. You get it from the tick, not the deer or whatever. Yes.
What if it's like a bunny, like a rabbit?
Rabbits generally don't bite. Well, as a general rule, if it's a wild one, you're not going to catch it. If it's a pet, you probably have it vaccinated. All right. We talked about air, water, people, So all of these things are things that are happening that you guys don't, maybe not even aware of. to help to keep us safe from any kind of health things. They also monitor the drugs, and I'm not talking about illegal drugs. I'm talking about our drugs that we take, our prescriptions. The companies that make drugs, they go and inspect those to make sure that they are clean, to make sure they're only adding just exactly the right amount of stuff that they should be adding. And if anybody, and you know you've experienced this, you've heard this on the news if you haven't had to do it yourself, but if something goes wrong or someone tampers with those drugs, what do? What is it called when they find out that somebody got sick from a particular kind? Tylenol. What's it called? A recall. They'll do a recall. And they'll get on the media and they'll say, if you bought Tylenol, and it says that they'll tell you the lot number, because they're all identified by number. And it'll say, check the bottle, and if it's this number, within this number, you need to take it back to where you bought it, and they'll give you your money back because someone has tampered with it. And that's happened many times where things have to be recalled. And food is the same way. They monitor food. They monitor farms. They monitor to check for cleanliness, to check for all that kind of stuff, to make sure what we eat is safe. So our government agencies do keep us safe the best that they possibly can. All right, you're going to need to remind me where we left off tomorrow.